Assalamu alaikum warahmatullahi wabarakatuh. This is Mrs. Bushra Mushtaq, PG Psychiatric Nursing. Today I am with the part 4th of the previous video, that is nursing theories and models of prevention. The content to be covered today will be the holistic health model. What is now holistic health? Basically, if we talk about our nursing nowadays, it is more concerned with giving this holistic nursing care. In this model, every aspect of the human being is covered and is considered as an important dimension of an individual by the efforts of the nursing to promote the health at its optimum level. So, and also not this thing, but the nurse, here considers the patients more important, and the patients are involved in their own health care. With this, they are able to have the personal control over their health. फॉर एग्जाम्पल चाहे नर्स कुछ भी प्रोवाइड करे, कोई भी इंटरवेंशन दे, मसाज थेरेपी दे, लॉफ्टर थेरेपी दे, गाइडेड इमेजनरीज, कुछ भी हो, सो these interventions are for the beneficial of the client, and the client gets involved for the promotion of his own health. और जो in the holistic way we are here, the most benefit of these therapies, चाहे वो हम नॉन इन्वेसिव प्रोसीजर्स करें, नॉन फार्माकोलॉजिकल प्रोसीजर्स करें, they should have the less side effects on the what is called at the client, for the client. And talking about this holistic what is called as holistic health, ये presume करता है to enlarge the traditional spheres of the medical, that is the allopathic considerations. And moreover, इसमें holistic health में हम क्या देखते हैं, illness को एक imbalance देखते हैं in the energy spheres of our emotional, of our spiritual, of our physical or social selves. And the healing is considered with the individuals balancing these energies. So it was the concept about the holistic health, what actually it means. Now, the holistic health, this means that there should be a harmony, there should be a balance in every aspect of the health. For example, we have already discussed about the definition of the health. What is health considered? That means it is considered to be the state of well-being, the state of a complete physical, mental, social, emotional, and not spiritual, and not merely the absence of any disease. So when we consider the health as that, and holistic aspect is considered the whole harmony between all these aspects of the health, that is physical, mental, emotional, social, moral, spiritual. इन सारे जो एस्पेक्ट्स ऑफ हेल्थ है, जो हेल्थ को डिफाइन करेंगे, इनके बीच में हार्मनी होना, इनके बीच में बैलेंस होना, वो इम्पॉर्टेंट होता है. दैट इज कॉल्ड द होलिस्टिक हेल्थ. Now, what are the dimensions of the holistic health? I already told you, as health has a different dimensions. It is not considered कि एक physical healthy है person, physically वो fit है तो उसको माना जाएगा healthy. No, there are in the same way the different dimensions of the health जैसे है, उसी तरीके से dimensions of the holistic health भी है. But difference यही है कि जो वो dimensions है, उनके बीच में आपस में harmony होना बहुत ही ज़रूरी है. एक बैलेंस होना बहुत ज़रूरी. If he is physically healthy, the physical health should complement his mental health, and the mental health should complement his spiritual health, and so goes for the other dimension as well, whether it is physical, whether it is mental, whether it is spiritual, whether it is what is called as social, whether it is emotional, जो भी है क्या इसको बोलते हैं वो कंसिडर किया जाता है एज द होलिस्टिक हेल्थ. अगर हम होलिस्टिक की बात करेंगे, it considers the person as a whole, as a whole, as a body is considered, mind, spirit, emotions, and ये consider करता है person को as a whole for his optimal health and wellness. ठीक है. और what is called as to achieve the health, to achieve the optimal health according to this holistic model, there should be a proper balance in the life and in all these dimensions also. और इसमें भी एज अ पर्सन होलिस्टिक व्हाट इज कॉल्ड एज होलिस्टिक हेल्थ में भी होल पर्सन को बिकॉज द होल पर्सन इज मेड अप ऑफ इंटरडिपेंडेंट पार्ट्स, एंड इफ वन पार्ट इज नॉट वर्किंग properly, definitely the other parts also will get affected. If physical part is not working good properly, and his mental or the other spiritual part may also get affected. In this way, if people have the balance in the physical, emotional or spiritual in their life, it can definitely negatively affect the overall health of an individual also. वो हो सकता है इसमें. Now if we consider about the physical health, क्या होती है physical health? We all know about the physical health. It means what our body is composed of, what are our developmental considerations, हमारा body कैसे function करता है, maintain कैसे करता है ये balance, right? So physical health to means to carry out the daily tasks without being very tired. So this is considered as the physical health. And for ensuring the good physical health, हम क्या करते हैं? अच्छा nutrition diet खाते हैं, we never skip our meals. If we have to maintain our good physical health, we take the meals at the proper time, we exercise, we go for the regular checkups, we sleep important है, कितनी important है, how much hours we should sleep, 6 to 7 hours uninterrupted sleep. We should avoid the harmful habits like smoking, drugs, or addictive substances. We should avoid. We should have the proper fluid. So in order to have the holistic health, the physical health maintenance is very important. Next is the mental and the intellectual health. What is mental? Or the intellectual, the intelligence, that is our cognitive, that is our thinking ability, thinking power, and the skills, they also are important for improving the overall health of the person. In our life there are various things which happen, and we have to we should have the ability to reason out, to analyze, to evaluate, or to create, or to rationalize our doings, or to rationalize our decisions. If I have taken for example any decision, I should be able to rationalize कि मैंने ये decision क्यों लिया, for the benefit. If I'm not mentally health, intellectually health, I don't have the cognitive abilities to take the decisions properly. For example, I will smoke, or take alcohol, and I'll say that it may reduce my tension, but on the same way I don't have the good cognitive skills, or rationalizing my decision कि how come is it possible that alcohol may reduce my stress. So the mental or the intellectual health are very important for maintaining the overall holistic health of an individual. Now the emotional health, right, our ability to accept or the cope with our own and others feelings. I should feel the pain of the others. I should not consider me as on the top and others on the lower side, and think about only my feelings, and no, I should take the pains, and if another is suffering, that's how I can maintain the good emotional health. That's my emotional health. It involves the understanding oneself also, the others also, liking oneself also, and the others also. If we are satisfied by ourselves and the others, then we have got the good emotional health. And For example, how can we have a good emotional health, like we can accept our strengths कि मेरे में क्या क्या ability है या मेरे में क्या क्या weaknesses है, वो मुझे aware होना है और उसको accept करना है. कोई stress आ गया, how can I accept that stress, and how can I handle that stress and seek the help from myself or my other colleagues. वो important है. That is how we can attain the emotional health, or how we can communicate. It is not कि emotional health you can achieve singly. No, you have to be in communication, you have to socialize with your family, friends, pulse, peer groups, so that what is called as you have a good communication, and you can burst out your stress sometimes with others also to gain a good emotional health. Next is the social health. What building the relationships. होलिस्टिक में ऐसा ही नहीं है कि मेरा फिजिकल ठीक होना चाहिए, मेरा स्पिरिचुअल ठीक होना चाहिए, बट आई शुड हैव अ गुड सोशल लाइफ. आई शुड एबल टू build the relationship with the others, harmonious relationship, satisfying relationship, whether it is with my family members, whether it is with my friends, whether it is with my neighbors, whatsoever उसमें. And being socially I should accept the norms of the society, and I should be able कि वो मेरे मेरे साथ वो मुझे एक्सेप्ट करे सोशली, ताकि मेरा सोशल वेलबींग अच्छा रह सके. ठीक है ना. उसके लिए मैं क्या करूँगी सोशल लाइफ के लिए. यू ऑल नो आई विल इंटरेक्ट विद द पीपल, आई विल हैव अ गुड इंटरपर्सनल कम्युनिकेशन स्किल्स, या मैं अपने आप को अच्छा साबित करने की कोशिश करूँ. आई विल नॉट इंडल्ज इन द एंटी सोशल एक्टिविटीज़ जिसकी वजह से मुझे कॉर्न आउट किया जाए, या आई शुड अंडरस्टैंड, आई शुड एक्सेप्ट द कल्चर्स which are prevailing in my society, so that I have a good social health also. Now the moral health में important बहुत कुछ होता है, जैसे कि one's faith. ठीक है ना. what I believe in, what are my values, what are my beliefs, morally, spiritually healthy. It is very necessary for the meaning of one purpose. Of, for example, I'm a Muslim and I have to accept all the criterias. I have to refer to my faith, and I have my own beliefs and the values. So because that gives the purpose to one's life. ठीक है. And there are no recommended ways to help to attain the moral or spiritual way. If you are a Muslim, if you accept the Islam, then you have to go according to the guidelines and accept that. उसी तरीके से आप अपने वैल्यूज़ को, बिलीव्स को मोर स्ट्रॉन्ग कर सकते हो, और अपने मॉरल स्पिरिचुअल हेल्थ को ज़्यादा स्ट्रॉन्गली कंसिडर कर सकते हो. इट इज़ अबाउट लुकिंग डीपली विद इन वन सेल्फ एंड अंडरस्टैंड कि क्यों वो एग्जिस्ट है, क्यों वो इस दुनिया में आया है, what are its faith, and what is its fate. ये सारा कुछ आता है moral spiritual that is health में. So the holistic health it covers all the aspects, जैसा कि health already बोलता है, और इनका बैलेंस होना बहुत ही ज़रूरी है, इम्पोर्टेंट है holistic health के लिए. अगर हम मेन टारगेट्स की बात करेंगे रिगार्डिंग द होलिस्टिक हेल्थ, तो ऑब्वियसली होलिस्टिक हेल्थ ये चाहता है कि वो व्हाट इज़ कॉल्ड एज मेंटेन करे नॉर्मल हेल्थ. ठीक. डिजीज़ को भी प्रिवेंट करे, जो ऑलरेडी डिजीज़ है उनको ट्रीट कर सके, प्रमोट पॉजिटिव हेल्थ कर सके, और मूव टुवर्ड्स द पॉजिटिव हेल्थ. ठीक है ना. ये कंटिन्यू रहता है. और अगर हम आजकल देखें, नाउ अ डेज देयर इज़ a trend to use the alternate and the complementary medicine therapies also. ठीक है ना. वो कर सकते हैं. And some use the both the allopathy as well as the alternate medicines together also to achieve the holistic health. ठीक है. एक कॉन्टिनम जैसा, जिसके एक एंड पे हाईएस्ट हेल्थ पोटेंशियल है और दूसरे एंड पे डेथ है. सो ये एक जर्नी रहती है कि किस तरीके से इंडिविजुअल अटेन कर सकता है हेल्थ, ग्रो टुवर्ड्स द हेल्थ. एंड इसमें बहुत इम्पॉर्टेंट है नर्स का रोल होना, knowledge होना about the different therapies which she can show to the client, and having the knowledge about these therapies, ताकि वो client को दिखा सकते हैं how to promote the positive health. अगर हम holistic ये medicine की भी बात करेंगे, from the conventional medicine to the alternate therapies जो हम use करते हैं for treatment of the patient. For example, I'll take an example of the migraine, ठीक है ना. Instead of giving only medications migraine के लिए, physician prescribe कर सकता है or he can look into the various factors as well that can cause the person the headache या other health problems, जैसे उसका diet देख सकता है, उसका sleeping pattern देख सकता है, stress level देख सकते हैं, problem तो कोई नहीं है पर्सनल या spiritual कोई practice तो नहीं है. सो देन ही कैन ट्रीट अ प्लान जिसमें क्या इसको बोलते हैं, ऑब्वियसली क्या इसको बोलते हैं, वो इन्वॉल्व करेगा symptomatic relief, but also he may involve the some other aspects also जो उसको ये relief ये migraine कम करने में help कर सकता है, जैसे कि some relaxation therapies, some stress management therapies, जिसकी वजह से the all what is called as holistic health is achieved. So these were the main targets of the holistic health belief model. That was all about the today's topic. I'll come soon with the next part of the video soon, inshallah taala. Assalamu alaikum warahmatullahi wabarakatuh.